हेलो एवरीवन एंड वेलकम टू माय चैनल डॉक्टर इन वाइट। सो आज की वीडियो होने वाली है हमारी मोस्ट कॉमन 50 क्वेश्चंस फ्रीक्वेंटली आस्क्ड इन एफएमजी एग्जाम। सो ये वीडियो को लास्ट तक देखना ना भूले और ये पार्ट 2 है, पार्ट 1 ऑलरेडी आ चुका है। तो अगर अब तक आपने नहीं देखा वो तो जाके प्लीज़ उसको पहले देखिए, क्योंकि हम 25 क्वेश्चंस ऑलरेडी कर चुके हैं। ऊपर आई बटन में उसका लिंक आ रहा है या फिर डिस्क्रिप्शन में भी मैंने उसका लिंक दिया है, जाके उसको देखिए। और अगर आपने वो वीडियो देख ली है तो लेट्स कंटिन्यू दिस वीडियो। So, question number 26, which is false about the Crohn's disease? A. No occurrence after the surgery, epithelial ulcers, skin lesions, or fistula formation. So, the correct option is that no occurrence after the surgery. So, let us know more about the Crohn's disease. So, Crohn's disease is a type of inflammatory bowel disease. It is a type of bowel disease and it causes swelling of the tissues. ये tissues की swelling कराता है. That is basically inflammation in our digestive tract, which leads to abdominal pain, severe diarrhea, fatigue, and weight loss and malnutrition. So basically the statement that is wrong about the Crohn's disease is that it does not occur after the surgery. That is false, and it can cause fistula formation, it can cause skin lesions, and it can cause epithelial ulcers. Question number 27. Best treatment for the anal cancer, squamous cell cancer is chemoradiation, radiation only, surgery, or chemo only. So for the anal cancer, squamous cells cancer, we will use chemoradiation as the treatment that combines chemotherapy and radiation therapy is known as chemotherapy. So the correct option is chemotherapy. Question number 28. Which of the following polyp is the least likely to turn malignant? Inflammatory polyp, hematmatous polyp, or hyperplastic polyp, or fab polyps? So first of all, what is polyp? Polyp is an abnormal tissue growth on the mucous growth. So basically the abnormal growth on the mucous layer. And what is fab polyp? It is a familial adenomatous polyposis. So here the correct option is hyperplastic polyp. So the polyp which will least likely to turn malignant is hyperplastic. So here you can see the microscopic image of hyperplastic polyp. Question number 29. Most common location of the lymphoma NGIT, that is gastrointestinal tract, is ileum, stomach, colon, or rectum. So the most common location is stomach, as gastrointestinal tract is the most common extraendocrine site involved in the lymphoma, with the majority being non-Hodgkin's type. Although lymphoma can involve any part of the GIT tract, the most frequent sites of the occurrence are stomach, followed by small intestine, then the ileocecal region. So the most common area is stomach, and after that we have small intestine, and after that we have ileocecal region. Question number 30. Which is true about the carcinoid tumor? Always benign, Kulczewski cells origin, present with paroxysmal hypertension, punch biopsy is done. So the correct statement about the carcinoid tumor is that it is having a Kulczewski cell origin. So carcinoid cell tumor are type of slow growing cancer that can arise several places throughout our body. ये हमारी body में बहुत जगह हो सकते हैं. And carcinoid tumor, which is onset of the tumor called neuroendocrine tumors, usually benign in digestive tract, that is stomach, appendix, small intestine, colon, and rectum, or in the lungs. So the true statement is it has an origin of Kulczewski cell, as you can see the microscopic image. Question number 31. All are true about the femoral hernia except it is common in nulliparous women. Lockwood infraguinal approach is done. Cuff impulse is seen. High incidence of strangulation. So the correct statement about the femoral hernia is that it is common in nulliparous women, as the complication that can result as a femoral hernia includes obstruction, where a section of the bowel becomes stuck in the femoral canal, causing nausea, vomiting, and stomach pain, as well as painful lumps in the groin. So you can see the femoral hernia picture given. Question number 32. The content of LITTRE'S hernia is omentum, bladder, Mcqs diverticulum, or appendix. So the correct option is Mcqs diverticulum, as the LITTRE'S hernia is a protrusion of the Mcqs diverticulum through a potential abdominal opening, and this Mcqs diverticulum is an abnormal pouch of tissue on the small intestine. As you can see in the image, that LITTRE'S hernia is any hernia containing the Mcqs diverticulum. Question number 33. In NYHUS classification type, 3A stands for which hernia? Femoral, direct, pentalume, or indirect? So for the 3A stands, it is a direct type of hernia. As you can see in the table, that 3A type is a direct inguinal hernia. If it's 3B, then it will be indirect with posterior wall weakness. If it's 3C, it will be femoral hernia. So you need to remember this table as it is very important for the exam. Question number 34. That MC immediate complication of splenectomy, that the main complication that occurs during the splenectomy during the menstrual cycle is fistula, bleeding from the gastric mucosa, pancreatitis or hemorrhage. So the correct option is hemorrhage. That during the menstrual cycle that complication arises during the splenectomy is hemorrhage. Question number 35. A 6-year-old girl brought with a high fever with the rigors for 5 days with the pain in the right hypochondrium region, and on examination the patient is ANICTERIC and tenderness is noticed in the right quadrant. What is the best investigation in this case? USD, serology, LFT or contrast CT scan. So what is USD? So first of all, USG is ultrasonography, LFT is liver function test, and CT is computed tomography. So here the best investigation is contrast CT scan. What is the name of the investigation shown here in the picture? So you have to identify the investigation in this picture. First of all, the full forms of MRCP, that is magnetic response cholangiopancreatography, and ERCP is endoscopic response cholangiopancreatography, and PTC is percutaneous transpathetic cholangiography. So here the correct option is ERCP. Question number 37. A patient with RUQ pain, USG is done. Shown in this image. Diagnosis is gallbladder malignancy, gallbladder stones, gallbladder polyps, or broken gallbladder. So the correct option is gallbladder stones, as you can see in the image. Question number 38. Pringle's maneuvers is used to control bleeding from inferior vena cava, cystic artery, hepatic artery, or hepatic vein. So the correct option is hepatic artery, as the Pringle maneuver is a one technique that enables a surgeon to halt the hemorrhage and find the source of bleeding, allowing the time for repair of the vessels in the setting of the hepatic resection of the benign and malignant lesion, and this maneuver can be used to assist control of bleeding. So here the correct option is hepatic artery. Question number 39. Severity of the acute pancreatitis is assessed by serum amylase, stool trypsin, Ranson score, or ARDS development. So the correct option is Ranson scores, that will assess the severity of acute pancreatitis, as we have the Ranson's criteria table. So you need to remember that. Question number 40. In case of annular pancreas, what is the surgery of choice? Duodenostomy, duodenojejunectomy, pancreaticojejunostomy, or portoinarostomy. So the correct option is duodenostomy, as you can see in the image. Question number 41. Which of these is the best for the management of a 3 cm stone in a renal pelvis with evidence of hydronephrosis? First, ESWL, PCNL, or antegrade pyeloplasty, or retrograde pyeloplasty. So the correct option is PCNL, that is percutaneous nephrolithotomy. So PCNL is a technique used to remove the certain stones in the kidney or the upper ureter. So basically एक technique है जिससे हम stones upper kidney से और upper ureter से निकाल सकते हैं. The tube that drains the urine from the kidney to the bladder that are too large for the other forms of stone treatment such as shock wave, lithotripsy, or urethoscopy. Question number 42. A 40-year-old man after the TURP of a BPH develops a seizure in post-operative state. What is the diagnosis? Water intoxication, anesthetic overdosage, mismatched blood transfusion, or malignant hypothermia. For this old man that develops seizures in the post-operative state will have water intoxication. Question number 43. Bell clapper testes predisposes to torsions, varicocele, cancer, or hydrocele. Correct option is torsions. So bell clapper deformity is a predisposing factor in testicular torsion in which the tunica vaginalis has an abnormally high attachment to the spermatic cord, leaving the testes free to rotate, and the bell clapper deformity predisposes to the intravaginal torsion of the testes. So here we have the normal position, and here we have the bell testes. Question number 44. Jordef is associated with hypospadias, phimosis, paraphimosis, or posterior urethral wall. So it is associated with hypospadias. So chordate is a birth defect in boys which the penis is bent during an erection, which even infant can experience, and males with chordate often have hypospadia, a condition where the opening of the urethral tube through which the urine passes is located on the underside of the penis rather on the tip. So here we used to have the normal opening, but in hypospadias condition we have the opening underside of the penis. Question number 45. Most common complication of stripping varicose vein below the knee is hemorrhage, neuralgia, thromboembolism, or infection. So the correct option is neuralgia, as you can see in the image. Question number 46. All are true about the Buerger's disease except ulnar and peroneal nerve vessels involved. Nerve involvement can occur. Superficial thrombophlebitis seen. Small acral vessels of phlegm involved causing the hyperhidrosis. So the correct option is small acral vessels of phlegm involved causing the hyperhidrosis. So what is Buerger disease? We need to know. So Buerger disease is also known as thromboangiitis obliterans. It affects the blood vessels in the body, mostly in the arms or legs, and these blood vessels used to swell, which can prevent the blood flow, causing clots to form, and these can lead to the pain, tissue damage, and even the gangrene. So that is death or decay of the body tissue. Question number 47. What is xenograft? Transplant from one relative to the other, transplant between the two identical twins, transplant of tissue cells, or transplant from one species to the other, to humans. So the correct option is transplant from one other species to the human. Craniopharyngioma is a brain arising from posterior pituitary median eminence neurohypophysis or Rathke pouch. So the correct option is Rathke pouch. As craniopharyngioma is a rare type of non-cancerous benign brain tumor, in this it begins near the brain's pituitary gland, which secretes the hormone that controls many blood function. Craniopharyngioma slowly grows. It can affect the function of the pituitary gland and other nearby structures in the brain. Question number 49. All are the derivatives of ectoderm except epidermis, parotid gland, neurohypophysis, or erector pylorem. So yes, erector pylorem is not the derivative of ectoderm. Epidermis is, parotid gland is, and neurohypophysis is. Question number 50. All is true about the development of timeline except implantations occurs at 20 to 22 days in the menstrual cycle. Implantations occur 20 to 22 days post fertilization. Embryo is till the 8th week of fertilization, or fetal stage is termed from 10th week of gestation. Here the statement implantations occur 20 to 22 days post fertilization is false, as implantations only occurs after the 7th to 8th day of the post fertilization. Statement A is correct, C is correct, and D is correct. सो थैंक यू एवरीवन फॉर वाचिंग दिस वीडियो। और अगर आपको ये वीडियो पसंद आई है तो प्लीज़ लाइक कीजिए, इस चैनल को सब्सक्राइब कीजिए, और आप मुझे कमेंट सेक्शन में भी बता सकते हैं कि मैं आगे वाली वीडियोस किस टॉपिक पे बनाऊं। सो नेक्स्ट वीडियो हमारी होने वाली है ऑन टॉप मोस्ट 100 वन लाइनर्स और फॉर द एनाटॉमी। सो डोंट फॉरगेट टू सब्सक्राइब द चैनल।